So continuing onwards with our assessment, we've already checked out the heart, so our next line of business would be to look at the pulses and the extremities just to make sure that there's adequate blood flow there. So we would check the radial pulses on both hands, which will be an assessment that we'll do again when we're looking at the patient's graft. As well, we'll be looking at the patient's pedal pulses and to assess the amount of swelling in the ankles, feet, and possibly in the calves. What we can do is we can actually assess for pitting edema, in which we put our finger against the skin and hold for 3 or 4 seconds. We remove the finger and see how long it takes for the skin to return back to its taut state, the depth at which one can press their finger, and the time that it takes to check for the skin to come back to its normal state determines the stage of the edema. And the further the stage, that's to say the longer that it takes for the skin to come back to a taut level, the more fluid that there is accumulated in the extremities, and the more this indicates that there's an issue with fluid overload. As before, we're checking the skin just to make sure that there's bright, healthy pink color, that there's adequate oxygenation to the extremities, and as well, while we're looking at our patient, we want to see whether or not there are any collateral veins or veins that are extremely bulging to indicate any sort of obstruction. We would typically see that in the chest region for a patient. We could also do a gastrointestinal assessment. We can ask our patient about their voiding habits, their bowel habits, and so on. Again, our patient is diabetic, and so we would suspect that they might also be voiding quite a bit, as that tends to be a part of the signs and symptoms of hyperglycemia. And we would ultimately, after finishing our physical assessment, ask our patient about their medication regime, their compliance towards their medications, and whether or not they have any concerns or challenges with respect to compliance. Should be mentioned during the graft assessment, but also while we're checking pulses, we should be checking for sensation, given that diabetics tend to suffer in the long term with neuropathy, so they lose sensation in their extremities, which we'll return back to when we're looking at the graft.